All right, what is the emotional muscle? We're about to find out because we have two amazing people from the Ottawa Psychoanalytic Society with us. Okay, we have Dr. Rob Northey. How are you?
Fine, thank you.
Wonderful to see you. And Sue Baxt is with us as well. Hi, welcome
Hi.
to the show. Okay, so Dr. Rob, can we talk about this emotional muscle? I don't know if I've heard about this term before, so what exactly does that mean when we're talking about it?
Well, I'm going to learn about it as well in some of the events coming up, but I think the basics of an emotional muscle is that in life all of us have difficult things that we have to face. We have to learn how to face difficult things and to think of it as an emotional muscle, just like any other muscle that you have to develop yourself, and this can be done as therapists. We have to develop some emotional muscle, but so do parents in raising kids and things like that.
Okay, Sue, so there's two people that are basically responsible for coming up with this term.
Yeah, Carrie Kelly and Jack Novick, who are a couple now based in Ann Arbor, Michigan, but really who travel the world, came up with it in around sometime in the 70s. When they were training and working in England.
Okay. Yeah, okay. And then obviously, I mean, so this is something that they've discovered and that they've been sort of like crafting over the years or finding out more about, or how is this developed?
If you work as a child psychologist or a child psychoanalyst, you come across the necessity to develop persistence or flexibility, these skills, these characteristics that are important when you become an adult. And I think that their creativity led them to call it emotional muscle.
Okay.
And what they've done is to expand the notion and to really develop it into something they can talk to parents about, something they can talk to teachers about, and have it make common sense. It's like, I knew that, or why didn't I think of that, you know, kind of thing. Make it very obvious.
Okay, which is great because you have two events coming up as well, where we will be, I guess, sort of jumping into this and finding out more about it. We'll get to that in moments, but Dr. Rob, tell us about the Ottawa Psychoanalytic Society. It's so hard to say. I'm not a doctor, right? Tell us about you guys. I mean, how long have you been around for?
Well, I don't know the exact date that it started, but we've certainly been around since probably the 1970s.
Okay.
And the Ottawa Psychoanalytic Society is the group of psychoanalysts who work here in Ottawa. We're a chapter of the Canadian Psychoanalytic Society, which is part of the International Psychoanalytic Society. So it's our organization where we can meet as colleagues and so on. But it's also sort of a platform for us to go and out into the community to teach people a little bit about what is psychoanalysis.
Okay, so what is it then, exactly? I'm very curious here.
I wish there were a simple answer, but it's a theory, it's a type of treatment, it's a way of understanding people. And certainly as practitioners, we use that understanding to try and help people through issues, but it's also something that can help anyone just sort of understand, if we think of the theory, can understand why we think how we think and things like that.
And have you had any luck trying to figure out people? Because I've been on Earth for 4 years. I don't get what's going on half the time, right? So, but it's got to be like a developing, like constantly process.
Well, as a theory, it's always developing.
Yeah.
I mean, we're so far on from the earliest, over a century ago, starting with Sigmund Freud, of course. But we're so much further along than that. And in terms of helping people, yeah, I think certainly there are times that using the theory, using myself in working with someone, they get to understand things that they didn't about themselves. But understanding oneself is an ongoing project.
Very ongoing, right?
It never ends.
Sue, so we have two events coming up, and I think the beautiful part out of the gate is they're free to the public. Would you like to tell us about the two events?
Yeah, we think they're so important, and that's the reason we're making them free. The one on Thursday night, next week on the 1st of June, is for therapists, community psychotherapists, and mental health workers to talk about developing and sustaining emotional muscle for themselves in their work, which can be quite exhausting, quite tiring, and some people burn out. So how to avoid that and sustain yourself as a caregiver, really.
Okay, okay. And the second event?
The second event is Friday night. I'm particularly excited about that. That's an outreach to parents and teachers and anybody working with children to come and learn about emotional muscle, especially building emotional muscle in the first 5 years in kids, but also dealing with difficulties with children who have had trouble developing emotional muscle later on.
Okay.
And also how parents, teachers, childcare workers can maintain their own emotional muscle and what they need to develop in themselves.
Okay, would it be important as well maybe for parents of newborns?
Oh,
newborns,
the more newborns parents that we see there, the better, because the development of emotional muscle starts from the very, very beginning.
Wonderful. We're looking forward to these two amazing nights, free, maintaining emotional muscle, building emotional muscle in children, first and second, and of course details at your website, ottawaps.ca.
Well, in that case, actually, probably best to go to the website for the Canadian Psychoanalytic Society.
Perfect.
But if you Google the Canadian Psychoanalytic Society, you'll get